Hello, I'm Dr. R Ichaporia. I'm a neurologist and director of neurology at Sahyadri Hospital, Nagar Road. Now, as you know, COVID has affected all of us and all the countries of the world, and people have suffered enormously. Most of us think that COVID is a respiratory illness, but the brain, nerves, and spinal cord also get affected with COVID. One of the major problems of COVID is neuropsychological problems. So many people get anxiety, depression, and some get psychosis and delirium because they are isolated in the hospital from their near and dear ones. Many of them are in the ICU and they do have no social contact. And being in the ICU itself is a highly traumatic event. Even the caregivers of COVID patients really suffer from a lot of anxiety and depression. And we have so many patients who have come to us with anxiety and depression. And this is something which decreases the enjoyment and quality of life and has created immense problem for the entire population. Even in those people who do not have COVID or their family members have not had COVID, because of social isolation and lack of social interaction, they have suffered from anxiety and depression. Now, coming to the pure neurological manifestations of COVID. Now, COVID itself affects a lot of the blood vessels of the body. So we have seen many patients of paralytic stroke because their blood vessels have got blocked because of COVID. And young people who do not have any of the risk factors for stroke and heart attack have got strokes and heart attacks because their blood vessels involving the brain and the heart have got blocked. And we have many such patients who in very young age, in their 20s and 25 and 30, with no other risk factors, have suffered strokes, and some of them have died. So in that way, it affects the families enormously, and it produces a lot of problem for the entire community. Besides this, there have been many cases where the nerves of the body have got affected. So facial nerve paralysis has been extremely common. And we've seen many patients with facial nerve paralysis and paralysis of the muscles of the eye. And therefore, they cannot see properly and they cannot turn their eyes in proper direction. And therefore, they have double vision. Also, we have seen a few patients who developed paralysis of all the four limbs, or what we call GB syndrome, where we have to give very expensive treatments to improve their condition. And quite a few of these cases have occurred in the general population and who have suffered COVID in the recent past. The most dreaded complication of COVID involving the neurological part is what we call Mucor Mycosis, that is the black fungus. And surprisingly, in this particular second wave, we have seen many such patients. Initially, we used to see Mucor Mycosis as a rare neurological condition, maybe 2 or 3 cases in a year. And in this period, we have seen 2 to 3 cases per day. Many of these people have died, and many of them have been terribly disabled. And we've had to do a lot of extensive treatments with drugs. Many of them were not available, and we've had to do radical head and neck surgeries, which have been very expensive and very disfiguring. And the mortality has been about 40 to 50%. So this itself has produced a lot of damage to the families and to the patients themselves. Besides this, there have been some instances of brain affection in the form of encephalitis and meningitis. And also, in the previous episode, in the previous wave, we saw many patients who could not smell or could not taste. We have seen much less of this in the second episode. So, in effect, COVID affects the central nervous system and it produces a lot of damage, and we need to control this disease by early vaccination and early treatment. The earlier you get vaccinated, the better it is for you, because you can prevent COVID. And COVID itself, though many cases are mild, but if you are unfortunate, you will suffer from neurological consequences. So my urgent plea to you is, don't worry about the vaccine. Yes, there have been few cases of vaccine-related problems, but very few. But so many other complications of COVID are there, and we should see how we can stop it in its tracks early. I'm sure you will have many queries about the neurological complications of COVID, so please write to us, or you can ask us for the answers to the many queries that you may have. Thank you once again.